Hello, class. My name is Megan Parmer, and I will be discussing the issue of nurse-physician relationships and how healthcare, our society, and future patients are affected. This topic is an issue in healthcare today due to people not working together, ultimately hurting and putting patients in danger. I cannot wait to dive into this presentation. My first goal is after the 5-minute teaching session, the learner will verbalize 2 feelings associated with the relevance of nurse-physician relationships. Second, following the presentation, the learner will list 1 negative way healthcare is affected by bad collaboration between a nurse and a physician. And lastly, 2 weeks after the presentation, the learner will demonstrate using one of the tips discussed in the session while working or having clinical in the hospital. Nursing is the nation's largest healthcare profession with more than 3.8 million nurses nationwide. With this growing profession comes collaboration with many personnel and most importantly, physicians. Both the safety and the quality of care patients receive depends upon the quality of the healthcare environment where care is provided. Doctors and nurses are the largest players, and it is up to them to start this environment right. Their crucial collaboration can improve patient outcomes, lower healthcare costs, increase job satisfaction, and maintain patient safety. Nurse-physician relationships are the building blocks to patient care and safety. This issue is relevant every day because teamwork, communication, and professional respect is needed to save lives. Not only does this current issue help save lives, its relevance is ever so needed to determine interventions and medical decisions. The issue of nurse-physician relationships influences nursing practice in both a positive and/or negative way. It all depends on each individual and how they respond to each other. Growing evidences show that improper or poor communication can create a chronic state of conflict between nurses and physicians, leading to increased medical errors and poor patient outcomes. There are many factors that hinder this relationship, and they are poor collaboration, lack of respect, language or cultural barriers, misunderstandings, gender differences, and differing education. Also, due to the above factors, nurses are not sure what to even report to physicians. In hesitancy, they do not call the physician for fear of bothering or interrupting their day. Mistakes caused by miscommunication can cost patients their lives. If all medical errors were tracked, it would be the 3rd leading cause of death in the United States. In saying this, patients are the ones suffering or even dying from our lack of collaboration and communication in medical settings. Healthcare is impacted by nurse-physician relationships because it is relational and team-minded. Healthcare is not one person working by themselves, but on the contrary, multiple diverse personnel working together to achieve patient care and safety. There are detrimental workers that make contributions such as food service workers, nursing aides, lab technicians, radiographers, and pharmacists. Each worker is needed to complete patient care while ensuring each patient is safe, fed, and monitored for any sudden changes. Who wants added stress and fear because 2 coworkers do not get along or listen to each other? If nurses and physicians work together and put differences aside, patient satisfaction improves because patients see us as professional and competent. This has a direct impact on quality of patient care and the patient's likelihood of continuing self-care upon discharge. Also, team satisfaction improves, which increases job satisfaction and reduces turnovers. Simple camaraderie and teamwork helps each individual feel heard, know they have their back if they need, and have their ideas and thoughts asked and respected. Nurses and physicians need to know that their actions can positively and/or negatively affect patients, each other, or family members. Nurses and physicians have deep social implications. Nurses and doctors have pledged to carry out public duties, most importantly the health care and well-being of each individual in America. However, when a nurse-physician relationship is negatively impacted, patients are not holistically cared for and mistakes are made. Society is impacted by this relationship because as healthcare professionals misunderstand each other, patients feel deserted. This decreasing collaboration causes patients to distrust healthcare systems. Distrust is a scary thing because then patients come to medical offices less, non-compliance rises, and self-care decreases. Also, when nurses and physicians do not correctly work together, unethical decisions and situations can arise. One story reported from Lynch and Morris was about a baby having severe brain damage as a result of the nurse failing to communicate to the physician. There are thousands of preventable situations that negatively affect our society, all by ignoring the need to ask for help or tell the physician imperative information. Let's positively impact America, healthcare, and each patient by respecting our colleagues, standing up to physicians when they are out of line, and building lasting camaraderie with doctors who we can learn and benefit from. 3 great hints for nurses are always using the S bar when communicating with physicians. Never answer the phone with, "I am sorry to bother you." And lastly, be ready and anticipate rounds. For doctors, 3 hints are always call nurses by their names. If you don't remember, always ask. Be a leader and don't boss people around. And lastly, encourage nurses who are doing a great job. In conclusion, the issue of nurse-physician relationships is crucial to patients, healthcare, and society. Patient safety is the business case for improved communication and interprofessional collaboration between nurses and physicians. Poor communication, unresolved conflicts involving the provision of care and treatment, and passive-aggressive behaviors impede safety and advocacy. How can we as future nurses help change the culture of this issue and put our patients first prior to our behaviors and misconceptions of physicians? No sole party is at fault, but all parties should take responsibilities for our current culture and work to change it.